Hi, I'm Dr. Muhammad Imam from the Department of Gastroenterology and Hepatology at the Mayo Clinic in Rochester, Minnesota. I have been asked by the Digestive Disease Week administration to discuss a poster presentation titled Outcomes in Primary Sclerosing Cholangitis Patients Receiving High-Dose Ursodeoxycholic Acid Are Confined to Early Stage of Disease. An earlier study showed that high-dose ursodeoxycholic acid, which is 28 to 30 milligrams per kilogram per day, increased the likelihood of development of clinical endpoints in patients with primary sclerosing cholangitis. This, however, was not studied in terms of disease stage. Therefore, we conducted a retrospective chart review of 150 patients with primary sclerosing cholangitis who have received high-dose ursodeoxycholic acid therapy. We classified the patients according to the disease status. This involved two factors. The first factor was the stage of the disease on histology, and stage 1 or stage 2 PSC were considered early stage disease, and stage 3 or stage 4 PSC were considered late stage disease. We also stratified them according to the second factor, which is the total serum bilirubin level. When the total serum bilirubin level was greater than 1 milligram per deciliter, this was considered elevated. And when less than or equal to 1 milligram per deciliter, this was considered normal. We then looked at the development of clinical endpoints, which included death, cirrhosis, development of varices, cholangiocarcinoma, or meeting minimal listing criteria, or liver transplantation. We then found that 49 patients of those 150 developed clinical endpoints during the period of follow-up. Our results showed, however, that patients with late-stage primary sclerosing cholangitis were as likely to develop endpoints whether on ursodeoxycholic acid therapy or placebo. However, patients with early-stage primary sclerosing cholangitis were more likely to develop endpoints when on ursodeoxycholic acid as compared to placebo. Patients with a normal serum bilirubin level showed an increase in development of endpoints when on ursodeoxycholic acid as compared to placebo. However, patients with an elevated serum bilirubin level showed no difference in development of endpoints whether on urso or placebo. In conclusion, we find that endpoints develop more in patients with late-stage disease. However, the effect of ursodeoxycholic acid in increasing clinical endpoints was more in patients with early-stage disease and normal serum bilirubin. Thank you.